Today, I have the great pleasure of hosting Dr. Julian Camastra to talk about biological dentistry and the terrain of teeth. In 2020, after losing touch with allopathy and germ-centered medicine, he became a student of terrain-based health. And when considering how his dental treatments fit into this new paradigm, he was faced with the harsh truth that he himself would not want the dental treatments that he was offering to his patients. This led him on a journey to discover other approaches to dentistry that were more harmonic with human well-being. He traveled to Switzerland and Germany multiple times to study under a few of the leaders in biological dentistry, which included having his own tooth treated. The experience was so transformational, he decided to dedicate himself to bringing these revolutionary treatment concepts back home to Canada. So in 2023, he founded Terrain Dental Wellness and the Canadian Biohealth Centre. So Julian, it's so great to have you here.
Yeah, thanks. Thanks for having me. It's really an honor. And I've been a fan, obviously, of the podcast for a while. So it's pretty surreal to be kind of the one in the chair. So yeah.
Is there anything more you want to say in way of introduction about yourself?
Teeth are obviously in the center of attention in the mouth, but we like to look at it as the mouth is the entrance to the body. So it's like the body's a hotel, the mouth is like the lobby. Right. So that's kind of how it fits in. And it's the first point of your microbiome as well. So we all like to focus on the gut health and all of that, but the mouth is where everything starts. And so it's really an important place to focus on in terms of optimizing overall health.
Nice. Well, the gut is here too.
Exactly.
Right? Like this is all, you can't separate.
That's one tube. Yeah.
Right, exactly. It's all continuous. There's no break in there. It's very sophisticated. And
yeah, the other thing like to tie that in is you hear of the term leaky gut, right? And there's different lines of thought on why that happens, but there's the same thing happens in the mouth. So we call it leaky gum. When your barriers in your mouth aren't in good condition, then same thing, you have things that you want to keep on the outside, like your mouth and your gut is considered outside of the body. And when you have these openings, then things that shouldn't be getting in there can get in, right? It's another nice way to think of the connection between the mouth and the gut.
Exactly. Yeah, I just thought of a very strange example how, sometimes drug users will rub stuff on their gums.
Yes.
And it's a sign probably of how incredibly porous that part of your body is.
Yeah, there's some medications you can just take under the tongue and they absorb right into the bloodstream.
Right, exactly.
The way I've designed this presentation is as a resource. So for anyone who wants to go back, there's going to be information up on the slides, websites, links, resources, studies, all that kind of stuff. You already heard a little bit about my background. So on the left-hand side, that's me with Dr. Ulrich Volz of the Swiss Biohealth Clinic and Swiss Dental Solutions. So I met him in the fall of 2022, and he told me that if I come to his course in Switzerland, that he would do my tooth for me. And so I took him up on that, and that's kind of what led me on this journey. And that was mentioned before, was a very life-changing experience for me. So if you want to learn about that link at the bottom, canadabiohealth.com/journey. I made a whole video about the experience. Then I met this guy in the middle, Dr. Dominic Nischwitz. He's considered the world's leading biological dentist. He's got a big presence on social media. He's been on every health podcast you can imagine. And I got took under his wing last year, and I went and spent 3 days one-on-one with him in his clinic, and that just kind of catapulted where I was at. And now I'm basically recreating what he has there in Germany, here in Oshawa, just east of Toronto. There's me with a few members of my team in the clinic, and we're due for another picture now because we've grown, and there's 3 doctors now working together and quite a big team now. So lots of exciting things going on. So biological dentistry, we're moving from the technician to the physician. So conventionally, dentistry's been a mechanical profession where you break a tooth, or you need a tooth replaced or something, and then you go and they fix it for you. Or you have a toothache and you go and they take you out of pain and they rebuild your tooth so you can bite on the tooth, smile, all those things. And I don't want to downplay, like, dentists do a really good job. It's such a highly technically difficult thing to do. And you learn these very fine motor skills to be able to restore these teeth so that they last. The mouth is a very hostile environment. So we're chewing, we're exposing our mouth to hot and cold, and the forces put on our teeth are pretty enormous. So in order to put something back in someone's mouth that's going to last, it has to be done very well. And dentists do a really good job at that. The thing that biological dentistry brings to the table is that we're really considering the overall health of the patient. And that's the number one priority. It's a shift from health being the priority, or to health being the priority, from biting and smiling. Does that make sense?
Yeah.
So a biological dentist uses the most biologically compatible dental restorative materials available and works with their patients to help them support and optimize their innate healing ability, resulting in the best possible outcomes. As biological dentists, we treasure our own health, and thus the treatment we provide our patients is at that same standard that we would want for ourselves or our closest family. So that's really it's the gold standard, right? It's the golden rule. And that's what led me on this transition. Was I reached a point where I said, I don't want these treatments that I'm offering to people. And then, that was a pretty dark place to be. And then it led me to where I am now. But yeah, that's what feels so much better about doing this kind of dentistry, is if you come see me as a patient, you can feel confident that what the treatment you're getting is what I would want for myself or my own family. That's really the shift. So I've kind of created a few categories here to help people just simplify the different types of dental disease that we see. The three categories are degeneration, and that's degeneration of teeth, like cavities, like we're talking about, and then degeneration of bone and gums, and that's known as periodontal disease or gum disease. Then we have toxification. So metals can be a toxin. That includes mercury, which is in the silver fillings. And then you can have infected teeth, particularly infected root canal treated teeth.
Right.
And then there's something else called cavitations, jawbone cavitations, and we'll talk about that as well. A lot of people don't know about that one, including most dentists don't know about that. And then we have anatomical and growth deficiencies. And this is what we see as a big thing today, leading to a lot of people having breathing issues and things like sleep apnea and bite problems and jaw problems. All of this is related to how we don't really grow to our full potential anymore. And it's a byproduct of our modern lifestyle. So we'll talk about that as well. I like this post. So cavities aren't normal. Getting braces and extracting teeth isn't normal. Snoring isn't normal. Mouth breathing and tongue thrusts aren't normal. Just because something is common doesn't mean it's normal. So this really captures what we're seeing in dentistry today, where it just has become common that yep, everyone needs braces. Yep, everyone needs their wisdom teeth extracted. Cavities, most people get cavities. It's just, we've come to accept these things of just facts of life, and it's a sign of degeneration and de-evolution of our species, right? And these things shouldn't be considered normal. So I really like this picture. It's a cross section of a tooth, and they've used different techniques to illuminate the different anatomical components of the teeth. And it just shows you how beautiful and intricate teeth are, and another one of nature's beautiful creations. So you can see the outer layer of a tooth, that's the enamel, and that's the hardest structure in the human body. And then underneath our enamel, we've got the next layer of a tooth, and it's called dentin, and it's a little bit softer. It's around the same hardness as our bones. And then in the middle, we have the nerve. So that's called the pulp of the tooth, and that's where the nerve tissues and the blood supply and even the immune system of the teeth are in there. So it's on this topic of biomimetics. So we're trying to learn from Mother Nature in how we approach our treatments in dentistry. When we're replacing teeth or we're filling a tooth, we want to do it taking into consideration how they were naturally designed and try to mimic that with our dental restorations. This just shows some very cool structures from antiquity that are still standing today. and it highlights the incredible strength of dome structures. So we've got the Pantheon in Rome, and you can kind of consider a tooth in the same way. So a tooth is like a dome, and if you look at how, the top part of the tooth resembles the top part of this Pantheon dome, and then we've got the walls which support it. And when a tooth is intact, it's incredibly strong. Like, the amount of force that we put on our teeth is enormous. Here's some more examples of arches. And the point that we're going to make here is that the strength of these arch structures is dependent on them remaining intact. Okay, so if we were to remove this middle section of this arch here, then the whole thing would lose its support. Like, if this was a weight-bearing structure and you took out the middle stone, then if that was supporting things above it, it would all fall down, right? And this is what we do to teeth when we drill into them and fill them with fillings.
Darn.
So when you get a cavity on a tooth, it goes right in the middle of the tooth where you can see here, and then the dentist has to drill into it to remove the decayed tooth structure and then fill it back up with filling material. But you're compromising the integrity, the structural integrity and the strength of that tooth, and it'll never be the same again. And that's something I really want people to internalize, because it's seen as a normal thing, like going back to before, where, yeah, I had a couple cavities, they did a couple fillings. But really what that means is your tooth will never be the same again. And now when it's put under all of these stresses that we do with chewing, and people do even more to their teeth, grinding and clenching, that's why we see people break teeth and they get cracked teeth, and then you end up with a toothache, and then you end up needing a tooth pulled. Right. So it's the start. Like, when you first drill into a tooth, it's now never going to be the same. This video here does a good job illustrating it. So he's got this flexible bucket. It's like a 99-cent bucket, and you can stand on it. You can use it as a stepping stool, even though you can see how flimsy it is, right? So he's cut two little areas in it, and that resembles like small fillings that you can get between your teeth, and it still has the strength. But as soon as you connect those two and you get what would resemble a larger filling, we'll watch what happens. He connects them together, and then now he can no longer stand on it.
Right.
So this is what we see happen with teeth, okay? So teeth get structurally compromised, and then these little cracks form, and then they propagate. It's like a crack in your windshield. If it doesn't get contained, it just starts to extend, right? And so as you keep biting on this tooth and the forces are put on it, then the crack gets deeper. And then you can end up having cavities form along those cracks, because there's a microscopic opening that bacteria can get into, and then you don't have a way of cleaning that. And so you can start seeing cavities form, like tooth decay form along a crack like this.
Can a cracked tooth be repaired?
Yeah, like if it's early, right? So if it's all about containing it. So if it's an early crack and you catch it early, then you can try to, you have to drill it, right? So you shave away the part of the tooth that's damaged, and then you build it back up. And that's using this biomimetic technique that I was referring to, and I'll refer to again. This is the tooth death cycle. And if you talk to 5 people, probably 3 or 4 of them have gone through this kind of thing, right? So you get initial cavity, and this is the whole goal of this presentation and the terrain theory is, okay, how do we encourage a healthy terrain so we don't get cavities, so we don't get tooth decay, right? Like I said before, our teeth shouldn't be rotting out of our head. That's a sign of something being very wrong. Okay, so you get a cavity, you get a filling, then you get cracks and decay in the filling, and then you got to either do a bigger filling or you got to do a crown, right? Because too much of the tooth has been lost. Then you get a crown. Hopefully that works, and the tooth doesn't become sensitive after. A lot of the times the tooth does become sensitive after you've drilled into it, or a dentist has drilled into it, and then you end up with a root canal. A root canal is when you have to remove the nerve and blood supply of the tooth. You hollow it out, clean it out, sterilize it, fill it back up. That allows the patient to keep the tooth for biting. And then oftentimes those root canals, as we're going to talk about, they end up getting infected again, and then they need to be extracted, and then you end up with an implant. So this is what we see all the time with patients. It's the cycle. You start with a cavity, and then the clock starts ticking, where after 10 or 15 or 20 years, probably they're going to be losing that tooth. Unless each step of the way, if the treatment's done really well, then there's a chance they can stop this cycle and prevent it from getting worse. But that's the challenge, and that's what dentists are striving to do, but it's not that easy. I mean, we want to look at this cycle, and at each step of the way figure out how do we prevent it from getting worse. So initially we want to prevent cavities altogether. And then if we get a cavity, we want them restored conservatively and biomimetically. There's this whole field of dentistry called biomimetic dentistry. So it's something you can ask. You can look on online directories. You can find dentists who've done training in biomimetic dentistry. If I needed a filling, I would want to see a dentist who's done this biomimetic tooth restoration training. And then if you end up needing a root canal, we'll talk about root canals. The alternative health world is like hardcore anti-root canal. We're going to talk about how there's a role for them, and particularly in the short term, it's a good solution for the short term, and then it's important to have a plan for the long term. So if you end up needing a root canal, you want it done by a skilled practitioner who uses a microscope, and they can do a really good job with it. And then same thing with implants. You want it done by a skilled practitioner using the strongest and most biocompatible implant material available. This tooth death cycle, it leads to something like this, right? And you get a patient who's had 9 root canals here, 2 implants, and it really at that point becomes a construction site in the body. And this is when we're talking about overall health, and we look at what kind of things have been done in people's mouths in effort to keep teeth for biting, we end up with all these foreign materials in our mouth and all these dead teeth that are prone to reinfection. And then it's no wonder why people end up with chronic health issues connected to their oral health. This slide here just illustrates how implants aren't always a perfect solution either. There's a study that I've linked to here that shows that 20 to 40% of titanium dental implants end up with some kind of inflammation or bone loss around them. And this is a couple of extreme examples. This one, the patient came in with this implant supported prosthesis in their hand. Their body rejected it. And you can see all of the corrosion and there's literally rust on the metal.
Ouch.
And that's in the jawbone. These things can work for a lot of people, but they're not without their problems. So when someone's losing a tooth, patient will often, you'll be talking to them about implants, and they'll say, okay, is this going to last the rest of my life? And you're like, how can you expect this to last the rest of your life? Like you lost your natural tooth that you were born with, and now we're just doing our best to replace it with something. We have better materials now, and I'm going to show them now, and I feel a lot better about what we have available to us now. And I even have one in my own mouth of these new style of implants. That cycle, that it doesn't end with implants is what I'm trying to say. A lot of the implants end up having problems with them too. So you can see on the bottom left, there's an example of some extreme bone loss around implants here. So all this to say that the best dentistry is absolutely no dentistry at all. and any decent dentist would agree with that. You don't want an intervention if you don't need one. That's the philosophy. Obviously, there's a lot that needs to happen to ensure that. And there's a lot of places where things can go wrong along the way that end up requiring some kind of intervention. But in an ideal world, you wouldn't need a dentist. If you look at animals in nature, they don't go to a dentist and they don't have dental disease.
Right.
So, that's like a big one for me. It's like this whole thing of you need a dentist and you need to be going regularly. Like for some people, yes, that's true. But for someone who's in an optimal state of health, that's not really true at all, right? So the problem is people end up doing things like this to their mouths, right? So this is the first category of degeneration, and this is dental decay or tooth decay or cavities or caries, all the same thing. You can see on the x-rays, you can see there's giant holes in the teeth. And this is an extreme case, but it just illustrates the point of this overall degeneration that's happening. I'd like people to think about it in the same way that a piece of fruit starts to rot, where it starts in one place and then it spreads from that point. And so the causes, there's a whole number of causes. Processed food, particularly refined carbohydrates and sticky foods. So that's like crackers, like crack for kids especially. That's a big one. If I could ban one food in the world, I think it would be goldfish crackers.
Very good.
That's what everyone gives their kids, right? And they're sticky and they get jammed up in between the teeth, and they're a simple carbohydrate, and they just breed tooth decay. Right. Then the next one that is a little less known is mineral deficiency. And the best example is a lot of times we see women who, after a pregnancy, they get a bunch of cavities in their teeth, and they may have never had a cavity in their life before.
Yeah.
And so what's happening there? Is it because all of a sudden they stopped brushing their teeth, or they weren't cleaning their teeth properly, or whatever? I think it's something deeper going on, and it's pointing to a mineral deficiency. And then when you're growing a baby, your body's prioritizing the metabolic needs of the growing embryo and fetus, and it's pulling. If you don't have enough reserves, it's pulling from you, right? And I think this is very intuitive. And so the teeth are like storage banks of minerals. They're a very highly mineralized structure, and they leach minerals, and then your body can use them to meet its deficiencies. So that's one of my theories. Like, I can't give you a study that proves this, but I think the pregnancy example is a really good one. And I see this being like one of the central themes of tooth decay.
Right. And then like the teeth are bones, correct? They're just
pretty much like
bones.
Exactly. Yeah. Like you can think of them like bones. Yeah.
Right. So the same, kind of osteoporosis thing where it's your body's desperate for minerals. It's,
Yeah.
you might end up eventually crippled, but it's not the quick death of the heart attack because
Exactly.
you lack electrolytes.
Exactly. In a really intelligent way, your body is saying, okay, we're short of minerals. We need them. Where can we take them from that's not going to put us in immediate danger? Like if it took minerals from your femur bone and you snapped your leg in half, you'd kind of be screwed. Versus if you lose some minerals from your teeth, yeah, you'll be okay from a survival standpoint, right?
Right, more so, right? The body likes slow death. That's what Garrett Smith always says, slow dying. Yeah.
And then eating habits come into play. So there's a lot of people that are grazers and snackers. And the problem with that is there's a pH balance of your saliva in your mouth, and that promotes remineralization of your teeth. And if you're always eating, your mouth will be in a more acidic state, and then it will favor demineralization. Then there's poor saliva and issues with the microbiome. Pharmaceuticals are a big one for that. So people who are on multiple medications notoriously have a dry mouth, and they get dental decay at way higher rates. And then there's the whole remineralization versus demineralization conversation I kind of touched on. But this is where, like, you hear people always say, oh, I'm born with soft teeth, or my parents or my grandparents had soft teeth, so I have soft teeth. Yeah, it's just nothing I can do about it. But the truth is, it's a living structure, and depending on what you're doing, they can become hard or soft. That's what remineralization and demineralization are. Does that make sense? Like,
yeah, if I could just ask it like blatantly, is it possible to remineralize a tooth that has become demineralized?
Yes, absolutely.
Good.
It's about what stage it's at. So demineralization happens without a cavity. So a cavity just means a hole, right? So it's actually like a depression or a hole in the tooth. If it gets to that stage, then you can't naturally regrow that, or at least I've yet to see it. Okay,
good to know.
Yeah, but
a lot of claims out there in the health world. Oh, you can fix your own cavity. Yeah.
Yeah, Look, I'm always open. If someone can show it to me, then I'll sing a different tune about that. But I just haven't seen it.
Okay, good to know.
And but you can remineralize it before it reaches the stage where it has become a cavity. Does that make sense?
Yeah, yeah.
So it becomes softer well before it cavitates.
Okay.
And then mouth breathing is a big one as well. There's a whole breathing side of dentistry as well, and it's pretty fascinating. So mouth breathing affects the saliva, and especially at night, right? So you can get into things like taping your mouth closed at night. I do this every night. So the solutions are lifestyle. You want to eat real food versus processed food. So single ingredient food, right? Around 3 to 5 meals per day, I would aim for, and that gets around the snacking problem. If you optimize your sleep, your circadian rhythm, manage your stress, then you're just going to have less taxation overall on your body that is depleting you of minerals. Yeah, your body uses minerals like a currency. And so if you're drinking alcohol, if you're doing drugs, all of these things leach you of minerals and even stress itself, right? So it's a currency game, and minerals are like the currency of our body. And if we're short, then we start to have this demineralization problem, right?
Yeah, you go into debt.
Yes, yeah. So for minerals, I tend to just like a good sea salt. I know, like for a while, I was recommending Celtic sea salt, and now there was some bad press that came out about that having lead in it and some other, bad things in it. I'm using one called Baja Gold sea salt now, and then there's Shilajit, which is really nice. It's a nice mineral substitute, and you can make a tea with it in the morning. So this is just some nice ways to get extra minerals into you. I drink all my water with sea salt. I think we can all agree that getting sunlight is good for you. And
The sun is essential.
yes, and sunlight helps raise your vitamin D levels, and then that helps your calcium absorption. So D3 helps your absorption of calcium in your gut into your bloodstream, but then K2 and magnesium, they're the cofactors or co-drivers, and they help the calcium go into the bones and the teeth rather than stay in the bloodstream. So this is the piece that's sometimes missing, where people know it's important to get vitamin D, but if you want the calcium to go to the right place in your body, you also need K2 and magnesium. And this is the same for teeth. Then, a lot of people use mouthwash, and there's like Listerine and all these things. These things are very toxic, and they kill your healthy microbiome in your mouth. And so that can disrupt your microbiome in your mouth and lead to factors that would cause cavities, right? Coconut oil is kind of the preferred alternative to that, oil pulling. You can just do it for 5 or 10 minutes in the morning while you're like making breakfast or doing dishes or something, and you just swish it around in your mouth, extra virgin coconut oil, and then spit it out in the garbage or the waste bin instead of the sink, because it'll clog up your sink.
Good tip.
Yeah, exactly. You'll notice like your teeth and your mouth feel really good after you do that, and it's supportive to your microbiome. It's a really nice practice. And good oral hygiene, so tongue scraping is helpful. Water flosser is very helpful for a lot of people. I have an image of it there. Xylitol and hydroxyapatite toothpaste can be beneficial. This is one of those things where, like, I don't use it personally because I never had a cavity. But for someone who is having trouble getting dental cavities, then you can use some of these tools as a band-aid, and you're just trying to use something that's not toxic. And so that's where things like xylitol and hydroxyapatite can come in. You want to use those things as a tool to help you solve this tooth decay problem, and then work on all the other areas of the terrain to solve it so that maybe you don't need those band-aids anymore.
Right. Okay, good. Yeah, that was a question someone specifically had. Yeah, my friend Sandra there about
Yeah.
hydroxyapatite.
Yeah, everyone's asking about toothpaste. It's like one of the most common questions. And like personally, I just use an Ayurvedic, no fluoride, but it doesn't have any active ingredient. It's called Oramir.
The brain.
Toothpaste is not a essential. Like,
right.
It makes us feel good. It gives our mouth that fresh feeling, but it's not doing anything for our health. A lot of the conventional toothpaste, like the ones that have whitening or tartar control, those kind of labels that you'll see, they're abrasives, right? So that's how they're whitening your teeth, is it's got like a sandy grittiness to it. And so as you're brushing your teeth, it's actually stripping away the outer layer of your enamel. And that's how it's whitening, but it's also removing healthy tooth structure. So this is a bristle, like a boar's hair bristle toothbrush.
Yeah.
I personally, I don't like it. So there's this whole trend online where people are saying like the toothbrushes have microplastics and you want to avoid it. And so I ordered these and I got them. I find them way too hard, and I'm worried about people tend to brush too hard. They scrub their teeth, and you're not supposed to brush like that. And so I worry about people using something like this and then causing all kinds of gum recession and abrasion of the teeth.
Yeah.
With one of these toothbrushes. Personally, I'm not so worried about the microplastics in a toothbrush. I think it's a little bit of fear mongering online, but you're welcome to take the information as it is and do what you like, right? It's your mouth, your body. But if you are going to use something like this, make sure you are very, very gentle with it. We have a tendency to get too manipulative of our body, and
Yes.
we're like it. I thought about this because you're saying about trying to manipulate the pH, right? Like, so use something that's alkalized. It's like, why are we trying to hack the system?
Bingo.
Like, yeah.
Bingo. It's exactly it. The hacking.
And we're not that smart. We think we're doing something good, and we really don't know what effects it's having, right?
Right. Yeah.
The last one here is if it's the mouth breathing issue that was on the last slide, then there's something called myofunctional therapy, which is retraining your body to breathe properly and have the right oral posture, the right tongue posture. And then there's techniques such as mouth taping. You got to be a little bit careful with that, but for some people it works really well, including myself, where you just put a piece of tape over your mouth at night. I made a couple of videos about this, and so that's my Instagram. I made a couple of videos about these topics of breathing and mouth taping and the sleep system and all that. The next category here is degeneration of the bones and gums. And so this is your gum disease or periodontal disease. You might hear the term gingivitis. That's like the very early stage of this, where it's just inflammation first, and then the degeneration happens subsequent to that. In this x-ray here, the bone levels should be much higher up around the neck of the tooth, like you see on the front teeth here, and then in the back teeth, it drops off. The bone drops, and then just like the tips of these molars are in bone, and the rest is exposed. Do you see that?
Yeah.
And same up here. This is some severe gum disease or periodontal disease. And it's on the same theme of degeneration. It's just instead of the teeth degenerating, it's the bones that are supporting the teeth. So people who suffer from this condition, their teeth get loose. As the dentist, you can push on the teeth and you can see they move a lot. They get to a point where they're just like dangling in there. Here's another diagram about it. So on the upper left, you have kind of a diagram of what a healthy tooth and gums look like. Then stage 1 is gingivitis, and you start to get inflammation of the gums. And then periodontitis is the next one, where you start to actually get some loss of bone and gums, and then a severe or advanced periodontitis, where it's like the image I showed you before, where just the tips of the teeth are still in bone and the rest of the tooth is exposed. And then you can see in this photograph here what this looks like in someone's mouth, where the teeth, they start to look longer, right? Because the gums and everything in the bones are receding, and the teeth don't have as much support anymore. So the causes of this it's that inflammation story, right? So it's like the leaky gut, leaky gum is kind of the same thing. I still think it's nutrient and mineral deficiency. And then I lean a little bit more towards like collagen and protein being important in maintaining these tissues, right? Your body needs to get the building blocks somewhere to maintain all of your tissues. We all know what someone looks like when they're emaciated, when they're just like their whole body is just degenerating and they're losing muscle and bone density and everything. They just look frail. It's the same thing with the bones of the jaw and the gums. And then what we were talking about before, nutrient depletion, mineral depletion from stress, alcohol, drugs, smoking, those are big factors in gum disease. Poor oral hygiene. And I like to stress it's not genetics, because that's the first thing people point to. And they go, oh, it's just your genetics. It's like, I don't think your ancestors would have survived very long if genetically your teeth were falling out. So some solutions: identify the root cause of the inflammation, look at your diet first, ensure adequate nutrition, particularly protein. With our patients, especially the ones that are going into surgery, and they're gonna need to regenerate a lot of bone and gum tissue and everything, I put them on a program with 1 gram per pound of body weight of protein. That tends to work really well.
Oh yeah.
Then the vitamin D, K2, magnesium is important for maintaining healthy bones, and including your jaw bones and your gums and everything. And then oral hygiene, same thing we talked about before. For the water flosser really comes into play here. You can even put a cap full of hydrogen peroxide in the water basin, and that's helpful when you're cleaning in between the teeth. And then a professional cleaning. There's this new technology now that's out of Switzerland as well that we've implemented in the office, and it's really nice. It's a much more gentle teeth cleaning. So this is showing the old methods, where they poke around in the gums and cause bleeding and break the barriers, the mucus barriers that are actually preventing things from getting inside your system.
Yeah.
And then all of the scaling, scraping of the teeth, like scraping at the enamel, right, can be very aggressive, a teeth cleaning. And so that's what I really like about this new technology, is it uses powder and water and air as like a very gentle power washer to clean the teeth. And so you're not using these sharp, aggressive instruments. So this is the GBT, guided biofilm therapy. So you disclose to see where the biofilm's actually there, and then that's the powder and water spray, cleaning all of the stain and tartar and calculus off the teeth. It's a lot gentler. So that's what I like about it. But this link at the bottom here is the company's directory, so you can easily find a dentist in your area. They're all over. So you can find a dentist who's employing this technology, and that kind of gives you a good indication that they're going to be just more like-minded in general, and they're investing in these kind of things, and they're implementing some of these more innovative technologies in dentistry. That's one thing in dentistry that's amazing now, is the technology. We love the technology. It's really helped catapult dentistry forward. What I want people to take away from this is, you hear all these hot button things and it's very black and white, and really they need more of a nuanced conversation. So that's true about root canals, flossing as well. Personally, I don't floss that much. Maybe once a week, like if I feel like I have some food stuck between my teeth. The problem is people don't have the right technique, and so they can actually cause damage. If you're not careful, you can cause damage to your gums if you're flossing aggressively. You want to wrap the floss around your middle fingers. You pull it tight, and then you use your index fingers or your thumbs to guide the floss, and you really got to slide it through. You don't want to snap it through and cause the gums to bleed. That being said, it depends on the patient. If you have a lot of fillings and crowns and all kinds of dental work in your mouth, then you need to clean between the teeth, because there's going to be little gaps and ledges and stuff that plaque and everything get trapped on, and you've got to clean it somehow. I like the water flosser. That works really well. Some people like to floss, and I'm okay with it. Just want to make sure you use the right technique and you're gentle and you're not snapping it through to cut your gums, and you're not going too deep, because that's going to cut the gums as well. Like the gums form an attachment to your teeth, and when you go too deep with floss, it's compromising that attachment, and it's kind of like that leaky gum thing. And now you've opened up an entryway inside your body from your mouth, right? We said before, animals in nature don't need a dentist, but in the modern world, most of us are eating some processed food, and we're not living like humans in nature would have lived. And so we still get buildup on our teeth and stuff. And so that's why it's helpful to go get your teeth cleaned every once in a while with something like this, because it is reducing the overall bacterial load on the teeth, which they do cause some inflammation of the gums. and just the food and tartar and calculus buildup that can be there, that is sometimes what's causing the inflammation. That's why I say oral hygiene is important, right?
Yeah.
So now we're into the toxification topic. The first one is metals. So we have all kinds of types of metals used in dentistry conventionally. So there's the classic amalgam, which is 50% mercury. So that's what's shown in these pictures here. And then we have titanium, like in implants. Then there's gold. There's stainless steel. A lot of people have those bars after they've had orthodontic or braces, orthodontic treatment. And so you'll have a metal bar bonded to the back of your teeth to prevent the teeth from moving. And those can sometimes leach metals into your body. There's another metal called chromium cobalt, another alloy. There's all kinds of metals used in dentistry. That's just the point I'm trying to get across here. But the problems with metals is there's toxicity of metals. There's a corrosion element. So you can see on the right here, there's this rusty propeller, and sometimes this can happen in the mouth with the metals in the mouth. Then there's electrical phenomena and disruptions that can occur. As you know, our bodies are electric, we're electric beings. And so when you put metals in there, it can interfere with the electrical system. There's the EMFs now. So when you have a metal in your body, it acts as an antenna. It's not bad enough that we're always surrounded by all these wireless frequencies and Wi-Fi and 3G, 4G, 5G, but now you've got something in your body that is an antenna pulling in more of those frequencies and exposing more of that to your cells, right? There's studies that show, like when you take a cell phone call and you've got a metal in your mouth, that it amplifies the amount of EMFs that you're exposed to. So that's something we deal with now too. Like in the 90s, this wasn't such a problem. Like if you had a metal dental restoration, probably you'd be okay from an EMF standpoint, right? There's this process called galvanic corrosion when you have two different metals connected in solution. So that's what often happens in dentistry. You've got one type of metal over on one side, another type on the other side, and then you've got your saliva, which is the perfect conductive element, and then you create a electrical current between the two, and then metals leaching from one to the other.
Wow.
Yeah.
There's another thing. Oh my goodness.
And any engineer, like my cousin is an engineer, and I was talking to him, but he's like, yeah, of course. Like, obviously that's going to happen. And I'm like, interesting. Well, I don't know why we don't learn that in dental school, but okay. So this is an example of that. This tooth over here, you can see the corrosion that's happened. So down here, that's the normal color of the metal of the dental amalgam. And then here where it's black, it's had this corrosive process happening.
Right.
So when you remove them, it's also a very crucial time where you're releasing all kinds of stuff from it, especially the mercury gas. So when you're getting your amalgams removed, you want the person doing it to follow these protocols to do it as safe as possible and protect you from what's coming out of the tooth. So it's called the SMART protocol, Safe Mercury Amalgam Removal Technique, and that's the International Academy of Oral Medicine and Toxicology. So they've got a directory, and the dentists they've certified in this technique, they're on the directory. So here is some titanium implants that were not doing so well, and this patient was having some health issues. So in his case, we decided to remove his titanium implants. This is what they looked like just on their own. I didn't remove anything here. Just you can see the bone loss that was occurring and inflammation around them. This here shows some of what we do to clean the bone after you've either removed a tooth or removed an implant, or you've treated a wisdom tooth cavitation or something like that. So this is another one of these nice technological advancements that helps us do a much better job cleaning infection in the jawbone. In this case, we replaced his titanium implants with ceramic implants. That's us putting in the new implants. This is another really cool modality that we use. It's called PRF. It stands for platelet-rich fibrin. So we're able to make wound dressings basically out of your own tissue. So we draw your blood, we spin it in a centrifuge, and then it makes these gels. And then we can put those back into the surgical site, and it really helps enhance the healing. So what we're doing here is we're concentrating stem cells and growth factors from your blood and putting them back into the surgical site to bring more healing cells to the area.
That's
and
incredible.
So yeah, it's really cool. And it's really cool to be able to make make these types of products out of the patient's own body. And so it's going to be compatible,
Amazing.
So this is something you can look for. If you end up needing a tooth extraction, then I call it a biological tooth extraction, where they're using some of these things. They're using an ultrasonic to clean the socket after the tooth's been taken out. And then they're using PRF. You can also use ozone, which is a really nice way to disinfect once you've taken out an infected tooth, right? And so these are things you want to ask about when you're interviewing prospective dentists to see how they're doing things. The next area of toxification is infected root canals. So I like to make the distinction, because not all root canals are infected, okay? Like, it's another one of these things that a lot of blame gets put on root canals, and I'm in agreement for the most part, but there's a big difference between a root canal that has a huge infection and one that was just done. If you just had a root canal done, it takes a few years before bacteria can get back into the tooth and you can start to see maybe some health issues. So I don't want to fear monger. I don't want to say that, like, oh, everyone who has a root canal, you need to go get it taken out. Like, that's not the message that I want to give in this presentation. It's just information. It's just education. So this is the case I showed before, where we had the construction site in the body. And so we have a big infection here that definitely needs to be dealt with, even from a conventional dentistry standpoint. What I wanted to show here is, this is the tooth next to it. It looks okay from an x-ray standpoint, but because this patient has health issues, he has prostate cancer, like we said, I talked him into letting me take this one out too. And when I show the tooth, this is the tooth. It's this black one. And that's the one that looked okay on the x-ray. Oh. So it's just kind of startling, like what you see sometimes when you take out these teeth. And this is what they looked like extracted. This is the one that looked okay on the x-ray. But this is really where I like to go with the conversation of, look, if you're having health issues, then get these things in your mouth looked at. And it's definitely something that could be contributing to your overall health. If you're dealing with something like cancer, then to me, it's just like, yeah, get the tooth out, get it done properly with the biological extraction protocol.
I was just going to quickly say, I wonder, to the degree that, I went through my whole cancer regime treatments and nearly dying 25 years ago now, and I never looked at the mouth one little bit. Yeah. There was actually one healer that said, I wonder if it's something about the mouth.
You have to look at the mouth. That's the message from, like, this group of dentists that I'm associated with now. And I've been giving some presentations now to doctors, to functional medicine practitioners and naturopathic doctors, to show them the same things I'm showing you now, that, you might have a patient sitting across from you and you're trying to help them with all these chronic health issues. You need to be aware of what could be in their mouth that could be contributing to their overall health status. And so I gave these doctors a list of questions to ask their patients. Do you have any metals in your mouth? Do you have any root canals? Did you have your wisdom teeth extracted? Have you had braces? All these kind of things, right? So here's just another quick case. This is a dental hygienist that ended up finding me, coming to see me. She's got a bunch of, these are the root canal teeth, right? They're the ones with the white filling material in the nerves. So she's got 1, 2, 3, 4, 5, 6, 7. She was having all this inflammation issues. So chronically inflamed knees and ankles that landed her in the ER. And she saw a couple specialists and they told her she had arthritis. They ruled out any autoimmune issue. Then she was just given classic antibiotics and steroids to manage, right? So she started seeing me in 2023 and we started working through these issues in her mouth. Same kind of situation here. You've got the severely infected one on the left, the one that looks okay. And I gave this presentation to a room full of dentists, conventional dentists, and I showed them this and I'm like, how do you think this tooth looks? And they're like, it looks good. It looks pretty good to me. I'm like, yeah, I agree. But I took it out and this is what it looked like. And it's like gangrenous, right? It's totally rotting. I asked the dentist, I'm like, well, do you want that in your body? And everyone's like, no, I don't want that in my body. You know what I mean?
Right.
So the conversations are happening. And I think in the next 10, 20 years, we're going to see a big shift in the right direction. This is another good guy to follow on social media, Dr. Kelly Blodgett. He sends every every root canal tooth that he takes out for analysis. And then they always find hundreds of different species of pathogens inside of these teeth. This is a really good podcast with him that you can look up. This is another really good guy to follow. This is the guy I did a lot of training with in Germany, Dr. Nischwitz. This is the hygienist I was telling you about. So we replaced her teeth with ceramic implants. And what I love about this picture is it shows how healthy the gums are around the ceramic. So I love to see this. I have one of these in my own mouth now. And there's just no inflammation caused by this material. It's just inert to the body. The body sees it as something neutral, and it doesn't see it as a foreign material. So that's what's really cool about what we can do in dentistry now. We can replace teeth with a material that doesn't trigger the immune system. And
that's awesome.
Yeah. Another conversation I like to have is that we didn't have these techniques and materials 20 years ago. Like these implants have been around just about 10 years in Europe, and they just started with them in the US in 2020. So it's not the worst thing that, for me, for example, I had a root canal on my front tooth for 27 years. I'm grateful that I had it and that I was able to keep the tooth for that long, and that it gave time for the technology and the materials to catch up. And then I was able to get one of these beautiful biologically compatible neutral materials as the replacement. If I ran and got my tooth extracted 10 years ago, I would have ended up with a titanium implant, and I'd be sitting here today wanting to take that one out. Do you know what I mean? So the root canal is sometimes a really good way to buy yourself time. Maybe it's finances. Maybe you can't afford this treatment right away. So a root canal might be the right thing to do in the moment to buy yourself time to get it done right, you know?
Yeah. Yeah, really good.
Here's just next stage of this same patient here. So we attach these ceramic posts on, and then we make teeth to go on over top. So that's how that works. So she's got her teeth restored, right? The really cool thing though is all her inflammation in her knees and ankles went away. She has no more swelling on her ankles and knees. She doesn't have to go slowly or cautiously up and down the stairs. She can cross her legs without discomfort, and she can wear sandals now. Like that was a big thing for her, right? That was pretty cool. And she was early on in my transition into this. So I wasn't even treating her for these other things. And I don't treat these other things. That's what I want to make evident too. I treat infection in the jaw, right? And then the whole system is connected, and that's why we can see great healing responses happen. But I'm not treating your chronic disease. I'm treating oral infection, right? It's
Right.
just when you put the body in a state where it can heal and there's no longer these chronic triggers, then the body can heal. The body's amazing at healing, right?
Yeah, it's what it does best.
This is my tooth. So this just shows another example. This is a one-piece implant. So in the front, we're able to use these one-piece ones where then you can cement a crown on over top, whereas the ones I showed before, this is a two-piece that we connect. I don't want the patient chewing on this during the healing phase. So we leave it without a tooth on it initially, and then we connect these posts, and then we cement teeth on after. So they're functionally the same. It's just two different ways to do it. Here's another example. This just shows how beautifully these ceramic implants can recreate what we're trying to do. Back to the biomimetic thing, we're trying to recreate nature in the best way possible with our materials we have available. This picture just shows we've really replaced teeth. And you can see how healthy the gums are. You have this very nice shape of the gums that we're going to be able to mimic what she has naturally.
Right. That natural arch structure.
Yes, the scalloping. Okay, now we're into the whole wisdom tooth and cavitation topic here. So a lot of people have had their wisdom teeth out. It's like one of the main, maybe 80% of people get their wisdom teeth out. When you take a tooth out, you're left with the socket. And then in an ideal world, what should happen is your body fills in that space in the bone with new bone. And unfortunately, because of many of these things we've been talking about, these deficiencies and other things in our modern life, this doesn't happen so well. And so people are left with these chronic lesions inside the jawbone where the extraction sites didn't heal properly. So it's most commonly seen in the wisdom tooth areas. So that's these red areas back here, where then you can end up with something like this in the jawbone, and it's a big problem. So here's an example. This is, you can see in the x-ray. Do you see the areas where the bone looks darker versus you have more a white appearance on the x-ray? In one of these areas where the bone didn't heal properly, it looks black. And essentially it means it's kind of a hole in there. There's no good bone that's mineralized into that space. So these lesions end up releasing all kinds of inflammatory mediators. And so you can actually test in these patients, it's been done a lot in the studies for these things, where patients who have these present, they've got these inflammatory markers elevated all the time in their system. This one's the famous one for dental cavitations. It's called Rantes. It's also known as CCL5, and the other one is FGF2. These are the ones that we see elevated. We don't regularly test for this. Not that easy to test for these things, but it's just what's been done in the background research of this problem. I also want to make sure I make a distinction between the word cavitation. We're referring to it as a cavitation inside the bone. It's different than a cavity in a tooth.
Got it.
Here's a little video that shows what one of these wisdom tooth sites looks like when we go in. So you can see all this fat. See the oil droplets? There's all this fatty deposit inside the bone. And we shouldn't have fat inside of our jawbone. So that's one of the compensation mechanisms that the body is using. When it can't grow new bone, it deposits fat in there, and that's trying to store the toxins that are in there and just protect us from them. But ultimately, it's still not great to have that in there.
You don't want
here's
that.
What one of those globules of fat looks like.
Wow.
This chart here shows the blood work between someone who should be at a normal level, and it's real patients. The ones that had these lesions, they have the elevated Rantes or CCL5 and the FGF2, and then the interleukin as well. And then the blue is the normal level. So this is one way we can quantify, what might be happening differently in someone's body who has these lesions going on. And then you can retest after you've remediated the issue, and you'll want to see these levels have dropped, right? So these are markers of chronic inflammation. They're normal. If you get an injury, if you get a cut on your arm or something like that, your body will naturally upregulate these things, but they're supposed to go up, you're supposed to heal, and then they go back down. But when you have these unhealed lesions in the jaw, it never heals, and these levels remain high. This is the meridians, right? So a lot of people know about the meridians and how our teeth are connected to other parts of our body. This chart is a really cool way to correlate where in your mouth, if you have an infection, whether it's a tooth or infected root canal, or if it's cavitation. We do this in the office. We give them one of these handouts. We circle the tooth, and then we tell them, okay, does anything along this column associated with this tooth correlate to your health problems? Like, do you have an issue in your shoulder or your elbow? Okay, that could correlate to this tooth, right?
Okay, incredible. Can people get that chart?
Yes. If you go canadabiohealth.com, then you'll find resources, and then there's like 8 or 9 different PDFs there, and this one is one of them. So this is another one of these cavitations. So you can see the darkened area on the x-ray here. That's where there's no mineralization of the bone. This is the plate of bone that we removed here, and you can see all the fat deposited on the underside of the bone. And then we cleaned it out, and you can see there's just a big hole inside the jawbone here. We made a larger incision here because we were doing implants for her as well. Normally when you treat these, you don't have to make such a big cut. This is the same patient as the one before. Her name's Carol. I did a video of her on my YouTube. She had an amazing healing response after we did her treatment. She had all this inflammation go away. She had joint inflammation. She had this weird symptom of this tightness along her right side of her body that went away. She lost like 5 pounds of retained water in the month or so after surgery. She tells us her story in this video here. So if you just search my name and write Carol, you should find it on YouTube. This goes through why does this happen? So again, nutritional deficiency results in poor healing. In order to build new healthy bone, the body needs the right building blocks to be able to do this properly. Vitamins, minerals, proteins, micronutrients, macronutrients. So the the 1 gram per pound of body weight of protein, that's an important factor. So I have my patients on a high protein diet after surgery so that they've got lots of material to build with. You want to be anabolic. So there's anabolic state and catabolic state. So anabolic means your body is in a state ready to build, grow, repair. Same as if you wanted to build muscle. If you're lifting weights and you're trying to build up muscle in your body, you need to be anabolic. So we follow the same principles for nutrition as if you were trying to build muscle, essentially.
And the catabolic state?
Catabolic is, thank you. I needed that. So it's your body is breaking down. You don't have enough to sustain maintenance of your tissues, and especially when you have a surgery, for example, we're demanding a lot more of your body in terms of repair and healing. And so if you're in a catabolic state or nutritional deficiency status, you're just not going to have the right materials to heal properly.
Yeah, that's living and dying right there.
Yeah.
I had no words for it, but I could tell the difference.
Yes.
Yeah.
And sometimes the conversation I have with patients, I had one today, and we're going to do this cavitation surgery for her. She doesn't eat enough. I'm going through with her. I'm like, you need to eat at least 1,800 calories a day just for your maintenance. And, I'm showing her what that would look like. And she's like, wow, I don't eat nearly that. And I'm like, yeah, you've got to really eat more.
Yeah, let's make eating popular again, because
Yes.
that's the whole thing. Everybody's into the fasting and the intermittent fasting, and I don't need to eat, or 1 meal a day. It's all crap. You can't detox that way. There's absolutely no way to detox, because it's eating that causes you to create bile. Bile is what allows you to move poison out of your body. Yeah. And especially the protein, right? Many women have changed their lives just by eating enough protein.
The vitamin D from the sun, K2, magnesium. I tell my patients, like, after we've taken out all these things from your mouth that your body doesn't want there, it's very normal to get sick in the weeks afterward. And I tell them, this is good. Your body's detoxing, support it through it. Don't try to block it. And That's a hard one. Like, for people who aren't on this wavelength of thinking, I've really got to coach them through that and say, like, they'll message me like, I got really sick. I'm like, no, that's okay. Like, that's healthy. Right.
Right.
There's some patients who need help detoxing. It's not enough just to take the things out of the mouth. They need someone who's going to guide them through a program, essentially, to help detox efficiently. So some people are healthy enough they can do it on their own. Some people need a little bit more help.
Right. Right.
A lot of patients are on this Dr. Pompa detox program, and I've heard really good things from my patients who've gone through that as well. It's like a lot of it is specifically geared towards detoxing mercury. So then there's the factors about cleaning the socket properly. So that goes back to the biological extraction we were talking about. So a lot of it is on the technique of how the surgery itself is done. Hydration is important too. Sometimes we'll take out a tooth or something and there'll be no bleeding at all. It's just dry. And then that patient's not going to heal well. So at least one thing I can think of that helps with that is hydration, just get better blood flow happening. And then I like to stress this, a lot of people have a surgery and they'll go right back to their normal life too soon and they'll be too active. And I really like to stress that people need to carve out that time in their life. It might be a week, it might be 2 weeks that you just had a surgery. Respect your body, just rest so that your body can actually put energy into healing and not have to worry about the daily stresses of life and fighting the tiger, right? Or running from the tiger.
Oh, that's huge. It seems to go without saying. Somebody had to say it to me a couple of years ago when I was really down, and it's like, Beth, you need to stop.
Yeah, you're doing too much. So yeah, like wisdom teeth especially, it's a major surgery, and sometimes people don't rest enough. They're up doing. I tell people, don't even take out the trash. Like, you're not allowed to take out the trash.
Right.
So this is a patient. This is kind of the most amazing healing response I've seen with one of my patients. So she was diagnosed with MS, multiple sclerosis, right? So in December, she had all this numbness going all throughout her body, in her feet and hands. And they found lesions on her brain in the MRI. So same thing, she was offered steroids and immune suppressants. She was already on the health journey, so she didn't want to do that. She did a whole bunch of lifestyle changes, and she was able to get about 60% better from her absolute low. She had this vibration sensation when she would look down. So December was her worst. Then she saw me in March. This was the piece of bone I removed to get into one of the cavitations. So this is a crazy picture, and you can see the fat. So in her, it was just gushing out. So we open it up and we're just cleaning all of this fatty deposit in there. She had an amazing response right away. So we're working on her, and she raises her hand. She's like going like this, moving her fingers, and I stop and I'm like, "Are you okay?" And she's like, "Yeah, I'm okay. My hand just went completely numb. Like it was always partially numb, and it went completely numb." And then the other hand had the same thing. I continued the surgery, and once I cleaned everything out, then both her hands went completely normal for the first time in months, which was pretty remarkable. And she had this huge emotional release after the surgery. And then she came back the next day for me to check on her, and same thing, her hands were good. And then I kept checking on her every month or so, and she's experienced 100% improvement in that numbness symptom in her hands. So
that is amazing.
Yeah.
Yeah. Yeah. Incredible story. Thank you for sharing. I teared up the first time you told me.
Oh, wow.
So good.
So this just summarizes. So her worst, I asked her just from 1 to 100 to rate where you are at each stage. So she got to 60% better and 40% better. And then, by April, she was 95% better with her hands, and this vibration symptom was 85 to 90%. And I think she's gotten better and better since then. This is this whole topic about jaw growth, and where we have deficiency and adequate jaw growth. This is a photo of two different children. So on the left, you have what's considered good, where you have big spaces between the baby teeth of the kid. And what this means is that, so the adult teeth are bigger than the baby teeth. And so when the adult teeth come in, there needs to be enough room for them. So when there's spacing between the teeth, it gives us a good sign that, yeah, this person is going to have enough room for their adult teeth when they come in. This picture on the right, all the teeth, they look beautiful, right? Like, so you'll see some kids and they have perfectly straight aligned teeth, but it's actually not good, because the next set of teeth that come through are going to be all crooked because there's not enough space for them. They're going to be all jammed up. And this is really the central issue of why people end up needing braces and why they end up needing teeth extracted to make enough room for all of them, whether it's wisdom teeth, or sometimes the premolars need to be extracted as well to make enough room for the teeth. So the root cause of it is underdevelopment and lack of growth of the jaw bones. And so there's not enough room for all of the teeth. This here is the same picture on the left, and then it shows there's enough room and the adult teeth can grow in straight. So spacing between baby teeth leads to straight adult teeth, no need for braces or wisdom tooth extraction, healthy airway and breathing, and a lower risk of TMJ issues, ear infections, dental issues, including cavities. In this case, where you have deficient jaw development, there's no spacing, it leads to crooked adult teeth. You can see the picture here where there's no room. See, they're all jammed up. It leads to jaws that are too small to accommodate adult teeth. They end up needing braces, wisdom tooth extraction, and it may lead to airway and breathing issues. And they have a higher risk of temporomandibular. Do you know what the TMJ is? It's the jaw joint.
For sure.
On both sides. So more likely to have issues, pain with that, ear infections, and cavities. This is kind of on the same theme as this. This is what can happen. So we talked about tooth grinding a little bit before. So here's an example of a patient who just ground the crap out of his teeth. And you can actually see, like on these lower teeth, you can see the enamel layer, and he's worn well through all of his enamel, and now that's the dentin layer underneath. For me, I see this as like a breathing issue, lack of development. The jaws are too small and everything is restricted, and so that's one of the reasons. Obviously, stress management plays into it, and there's probably other factors too. This is the same guy. This is what his teeth looked like from above. You can see worn right through all of his enamel. This just shows kind of, I showed you the child before of what leads to something like this. And then this is what we see in the adult. So if you don't get it early, if you don't address this growth deficiency, then you can see big problems happen once that person is adult age. This is him. Fortunately, today we can do things about it to help someone like this. And so we're able to restore his mouth and rehabilitate the whole thing. So the whole Weston Price thing, he was really onto something. He wasn't wrong in that these traditional cultures, they had no dental disease. They had beautiful wide faces. So that's like this picture over here. They have round, wide faces. And then as we see people move more onto a Western lifestyle, then they get more narrow faces and the jaws don't grow as much, right? Where Weston Price may have got it wrong was that he linked it to nutrients. He linked it to the fat soluble vitamins. At that time, they were kind of obsessed with vitamins. His diagnosis of like people's jaws not growing and everything as they shifted onto more Western lifestyle was correct. He was really onto something. And then it happened in the successive generations of the traditional cultures too. So he compared it to their grandchildren too, that had been introduced to white flour and sugar and all these things. And they showed the same dental diseases that we were seeing in Western countries like America and Canada and whatever. So there really was something there. There's different factors at play. I think like living a more outdoor lifestyle in the sun, all of those things contributed as well. So the other thing is the actual consistency of the food itself. So food, as we process it, and like with industrial processing of food and the Industrial Revolution, we started really pulverizing and blending and doing all these things. And even how we cook food, if you really pay attention to your next meal and the next 10 meals, think about like how much chewing do you really have to do with the food. And most of our food today is pretty soft, and so we don't actually use the muscles of our face to chew our food. And so that's one of the main factors that leads to this underdevelopment and this poor growth of the jaws.
I get it, right? It's like any part of your body that you don't use, that part of the frame is going to diminish because your body doesn't need to manufacture bones to not
responds
support.
to the stresses, right?
That's right.
Yeah. So over on the left here, I have some examples. I love this conversation. This is like my favorite topic. This has happened over a long period of time. So we can go back however long we want. Before humans were an agricultural society, if we were more like hunter-gatherers, like we see with the Hadza and these other nomadic tribes, before we started cooking food, we actually had to chew raw meat off the bones, and we were like chewing all day and using our jaws. And so if you look at old skulls, like they're massive, they've got these massive jaws. At a certain point, we started cooking food. Cooking food makes it softer, and now we're not using our jaws as much. So as soon as we started cooking food, and even as soon as we started using tools like knives and stuff to cut up food, we didn't have to chew as much. And then you introduce agriculture. But even in more primitive agricultural societies, they still didn't have all these dental problems. You can still look at like the catacombs in Paris, different deposits of old skulls in the world. They still have straight teeth. This is a half of a skull. You can look at skulls and you can see, all the teeth are straight and they've got all the molars in and everything. So that's what's interesting when you look at old skulls. Let's go forward to like the advent of refrigeration. And that's quite a new advancement as well. So before refrigeration, we had to smoke and like dry out meat to preserve it. And then we would be chewing on this leathery meat, and think about what a jaw workout that is when you're chewing on like a hard piece of beef jerky, not like the soft stuff you get in the store now, but like shoe leather, really. If you chew something like that, your jaw gets tired. The muscles get so tired. And that's really the stimulation that we should have to induce proper growth of the jaws. Then there's the topic of baby-led weaning. Since the advent of Gerber and baby food, we feed our kids these pureed foods. And now they're in these little convenient squeeze packs, and people give them to their kids in the car and there's no chewing. It's like a liquid diet, essentially.
And liquid sugar,
Yeah.
drinking the carbs.
Yeah, exactly. So you don't want to drink your food, right?
Right. Unless
And
you're
breastfeeding is the other one. So breastfeeding is very important as a initial input to the system to encourage the proper growth of the jaws and even facilitate the right breathing. So when a baby is breastfeeding, they're forced to breathe through their nose and the tongue is in the right position. And the recommendations generally to, like, if you can, I know some people struggle with it and that's fine. It's just know that your kid's development is going to be affected by not breastfeeding, right? So 18 months is usually a good amount of time for breastfeeding. And then if you follow the baby-led weaning, you just introduce real food. You skip the baby food stage altogether, start introducing real solid foods to your kid around 6 months usually. There's some resources on this whole topic. This is my favorite guy on this topic, Dr. Ben Moralia. He has this directory here of all dentists that have gone through his training. This is a pretty cool book about this whole topic as well. So that's it. Thank you for everyone listening. Thank you, Beth, for having me. Here's my information here. Here's the doctors that I work with. There's my dad on the right. He started our practice, and then my brother and I. And now we have another doctor, Dr. Polovic, that's joined us. He kind of looks like he could be related to us. And yeah, that's about it.